Welcome to Coffee with MedicareBob. My name is Robert Bache. I own Senior Healthcare Direct MedicareBob's office, and we help people with their Medicare nationwide. Today, I am blessed to be joined by Susan Wagner. Sue is actually a client that I helped a couple years ago, and in this video, we're going to go over some of the questions that she asked me then that she found so helpful, and that we helped her find the right plan for her. But before we do that, I also want to share that Sue felt like we did such a good job that she actually wanted to join our team. So for the past couple of years, she's been a valued member of our customer support team. And so I'm going to introduce Sue, and I'm going to let Sue tell you kind of what she does for our team and how she helps people. So Sue, go ahead and introduce yourself and tell us what you do with us.
My name is Sue Wagner, and I'm in the support group. And I answer the phone. I talk to the members. I really help them with any kind of questions that they have. I'll get them to a great agent. Of course, all our agents are great.
I like how you call it a support group, because that's what it feels like sometimes if you're on Medicare, you need help.
Yep.
But yeah, so you're on our member support team,
Yep.
and you help with approval calls. So what is an approval call? Like, how does that work?
When someone's approved, I give them a call. I let them know that, hey, you're approved, and if you have any questions, we're here to answer your questions. We have a whole team just for our members.
Awesome. And do you help them cancel their current insurance so if they have another plan to do by themselves?
Yes, if they need help canceling their plan, that's what I do. I'll do a three-way call with them over to the company that they have their current coverage with.
Cool, because nobody wants to pay for two supplement plans at the same time, which before we had a support team, you know, sometimes people would switch their Medicare supplement plan to switch money, and then they find out a couple months later they were paying for both. So to prevent that, we have team members like Sue that they make sure that, you know, we'll call the carrier they have now and we'll get that canceled for them. And also, I'll brag about you a little bit, Sue. So we have a third-party referral site called Shopper Approved. And on our support team, Sue has either is tied or has the most 5-star recommendations from clients, because when they call in, they might have a missed billing, they might have a question about a drug plan. She does annual reviews with them every year on their drug plan and supplement. And Sue, I just want to say thank you. You do such a great job, because you do have the most positive 5-star reviews of all of our support staff.
Well, thank you.
So that's great.
Well, I even got flowers one day.
You did?
Yes, I did.
A client, and what did you help that client with?
Well, I helped her save a lot of money.
On her supplement?
Yes.
Awesome. That's great. Well, that's awesome. And we have more and more stories like that too, and I thank you so much for that. So now what I also want to bring you on is that Sue really is a client. I mean, that's how I met Sue. She found us online a couple of years ago, and I assisted her with her coverage. And so I just kind of wanted to go over, I find, because I do help quite a few people, that most people have the same questions most of the time. 90% of the questions that Sue has is probably 90% of the same questions that somebody watching this video that's going to be on Medicare or new to Medicare has. So kind of go ahead and let's start with how our conversation went. So what kind of questions did you ask me a couple of years ago?
I said, what is Medicare? What is that?
Right. So many people get, you know, my mom still calls me MedicareBob, even though I'm Medicare Bob, which is, both are corny but easy to remember. So Medicare is insurance that the government offers. Some people confuse Medicare and Medicaid. The way I remember it is, think of Medicaid as aiding people. So like for low-income people, it aids them. Medicare is caring, right? Like we care, and so that's your health care. So Medicare is health insurance that the government provides. There's two parts to original Medicare. There's Medicare Part A, and there's Medicare Part B. Now, Medicare by itself does not pay everything. So a lot of people think that, the couple of misinformation or confusion out there is they think that Medicare pays everything, and they also think Medicare is free. And as you know, Medicare doesn't pay everything, and Medicare definitely is not free. Now, Medicare Part A, most people do get for free, but really you already paid for it, because as long as you worked 10 years, 40 quarters, you get Medicare Part A for free. Or if you were married to somebody who worked for 10 years or 40 quarters, you're going to get Medicare Part A for zero premium. However, everybody, unless you qualify for low-income subsidy, you're going to pay a premium for Medicare Part B, as in boy. And that national average premium this year is about $145 per month. And if you're on Social Security, that typically comes right out of your Social Security check. Now, Medicare, as I mentioned, doesn't pay everything. Medicare Part A is for hospital bills. Medicare Part B is for your medical and doctor bills. Now, Medicare Part A, when you go to the hospital, you have to pay a Part A deductible, which this year is about $1,400. Now, that's not per year, that's per occurrence that you go into the hospital, you're going to owe that $1,400.
Right.
All right, so it's not, it's not just per year like we're used to a lot of deductibles. That's per occurrence outside of 60 days. Now, also with Medicare Part A, if you're admitted in the hospital, God forbid, longer than 60 days, you'll pay over $300 per day while you're in the hospital. So that's Medicare Part A. You don't have to have that memorized, just it's going to cost you about $1,400 every time you go just for walking in the door. Now, Medicare Part B, as in boy, that's for your medical bills, doctor bills, lab work, imaging, physical therapy, speech therapy, outpatient procedures, pretty much everything other than room and board at the hospital. Now, Medicare Part B does have a very small annual deductible, which for 2020 is only $198. So that's your first $198 that you pay. And then after you pay that, Medicare is going to step in and only pay 80%. And that's the real scary part to Medicare, because as you know, there's no limit to the 20% that Medicare doesn't pay.
Right.
So if you only have Medicare, your financial exposure is unlimited, because at 20%, there's no limit.
Right, exactly.
So a follow-up question to that is, what are your coverage options, right? That's what we go to next. So now that we know Medicare is about $145 a month, and it doesn't pay a lot, or pays a lot, but not everything, what are your options? Well, so how many commercials do you see in October about how many options there are in Medicare?
A lot.
You don't get any mail from the carriers about options, do you? There's nothing, your mailbox isn't full every couple days, is it?
Yes, it is.
You don't get any cold calls from the Philippines, do you?
Yes.
About Medicare options? Okay. So if now you know this because you work in this industry, but when I talk to somebody, and when I first talked with Sue before she got into the business, you ask somebody how many options do you think exist, and their answer is thousands or hundreds at least, right? So the biggest value that we do is we help them understand that everything fits into one of two categories, right?
Right.
As you get familiar with this stuff, there's really two options. It's either going to be, so we always look at it as a T-chart. So we draw a line down a piece of paper, and it's either going to be a Medicare Advantage plan or a Medicare Supplement plan. And what can be hard about this is that there's not a bad option. They're both good options. And it really just depends on what type of coverage a person prefers. So I'll give you a summary about Medicare Advantage. Now, due to Medicare guidelines, I'm not allowed to talk about plan specifics with Medicare Advantage. I will tell you Medicare Advantage plans are county specific, zip code specific to your area. So Humana Gold Plus might have a plan in Dunedin, Florida, or Palm Harbor, Florida, that's not available in Houston, Texas.
Right.
Now, there might be a Humana plan available in each area, but it's not going to be the same plan because the benefits are going to be county specific. So if you have family, I know you live here in Florida, but you said you're from originally where? Where are you originally from?
New York.
Okay, so I think it's a little bit warmer here. There's also probably more New Yorkers in Florida
I'm
now.
from Buffalo.
Buffalo, okay, yeah. So a lot of people moved down here to get out of that. So you might have had, you might have friends in Buffalo that are asking you for advice on Medicare, and you're like, oh, take a look at this carrier with this Advantage plan. It's really, really good. But then your friend goes to look for it, and it's not available in Buffalo, because you live in Florida. So that's what you really have to understand about Advantage plans is they are county specific. In cities, they tend to be larger cities, more populated areas. They tend to be a little bit stronger benefits. With a Medicare Advantage plan, the first thing you want to write down if you are doing a T-chart is that it's not a supplement.
Right.
It's not a supplement. It's actually not. It's not going to pay the bills that Medicare doesn't pay. Now, what it is, it's a private alternative or replacement to Medicare. Now, that's not a bad thing necessarily, but the concept is it's not a supplement. So if you go to the hospital, it's not going to pay your $1,400 that Medicare would charge you. It's going to have its own charge, its own fee, its own benefit package. And it's going to charge you, on average, around $300 each day you're there, days 1 through 7. So if you're there for 3 days, it's $900. Well, that's better than the $1,400 Medicare would charge, right? But if you're there 7 days, now it's $2,100, and that's more than the $1,400 that Medicare would charge. So it's not better or worse, it's just different. Okay? It also does not pay the 20% that Medicare doesn't pay. Okay, if you actually look at most plans, you actually pay 20% for things like cancer, for things like imaging, like MRI or CT scan. And if you don't have a 20% charge, you might have a 10% charge or a 30% charge or a flat copay. Maybe an MRI for a knee is $375. Maybe a X-ray is $75. So the concept there with an Advantage plan is it does not fill in the holes to Medicare. It's just a different set of holes or a different set of benefits.
Right.
Now, these are attractive sometimes, though, because they advertise on TV every day, it seems like, at zero premium. You know, Joe Namath is on TV right now with a commercial, and it's not even for a carrier. It's actually it's a lead generation company that you can buy those from. And Joe Namath is telling you how great Medicare Advantage is, and it's you know, and that's okay because it's not bad, all right? But it's a little bit misleading in his commercial. But it's but these are the plans that you see advertised as zero premium. So you know, they might say Gold or Plus or Medicare Complete or all in one. So what those are, they're not a supplement. You're still going to have copays and stuff for everything you do. Now, they are, and they're not really zero premium either. Okay, you're going to pay your Medicare Part B premium. Now, in some areas, like in Florida and Arizona, you might have what's called a Part B rebate. But 97% of those Advantage plans are actually going to pay the Medicare Part B premium of $145 a month. And then that's why they call them zero premium, though, because a lot of them have no additional premium. So the reason that they're really the same price as Medicare is because, as I shared with you, it doesn't pay the bills that Medicare charges. Now, some of them have dental, vision, and hearing included. Okay,
Right.
but if you look at them, it's a discount program. It's not traditional type of insurance that we've had. And the nice thing about them is, considering that Medicare for that same $145 a month doesn't have a max out of pocket, at least the Medicare Advantage plan does have a max out of pocket.
Right.
Which this year the national average, I believe, is about $6,700. So with an Advantage plan, you know, for the same price as Medicare, if you have a really bad year, at least the max you'll pay each year is $6,700. Now, you are giving up your right to go to any doctor, any hospital. So you will have an HMO or PPO with the Medicare Advantage plans.
Right.
So that's an Advantage plan. So it's going to be an HMO or PPO, so you have to go to certain doctors. You're going to have a benefit package. It's going to include some dental, vision, hearing discount programs. Some include a gym membership. Some include the drug coverage. But you have whatever drug plan's included in that. You don't get to find the drug plan that's going to save you the most money. It's just whatever one's included. So the pros to the Advantage plan is it's going to be cheaper per month premium. The con is you're going to have to go to certain doctors, certain hospitals, and you're going to have a bill for everything you do until you reach that $6,000 or $7,000 max out of pocket.
Makes it a little hard to travel, though.
That's right. That's right. If you travel, a Medicare Advantage plan might not be the answer for you, because you have coverage only in your area, in your network.
Got to stay in network.
Yep, good point. And you also got to get referrals. So
Yeah.
if you want to go to a specialist, you have to get a referral. If you want to get an MRI or a knee replacement or a CAT scan, you have to get what's called prior authorization. So you have to get the insurance company's permission to get that. So that's an Advantage. So it's going to be cheaper per month, but you have bills for everything you do. You're limited on where you can go. You have to get referrals. But at least you have that safety net of no matter what, the max out of pocket's going to be, you know, $6,000 or $7,000 depending on where you live. Some might be lower. Some might be up to $10,000 that I've seen for 2020.
Right.
So now the next option is called a Medicare supplement. So far, if you have a dining room table, you can fit everything on two piles. The first one's Medicare Advantage. The second one is Medicare Supplement, also called Medigap.
Right.
And this is an actual true supplement. It's the best coverage you've ever had in your life as far as actual coverage. Now, you're going to pay an additional premium. Okay, so you stay on Medicare A and B as your primary insurance. So you pay Medicare the $145 a month.
Right.
You keep Medicare as your primary, so that means you can go to any doctor, you can go to any hospital, you can travel with it. As you mentioned, you have the same coverage in all 50 states. Okay, same coverage. And you're going to pay an additional premium, anywhere from $80 to $150 per month. But in return, you keep your doctor, go to any hospital, and it actually pays the bills that Medicare doesn't pay. So when you go to the hospital, not if, when, right? We're all going to go, okay? But when you go to the hospital, instead of you paying the $1,400 that Medicare charges, the true Medicare supplement's going to pay that for you every single time you go.
Yeah.
So, Sue, if you go to the hospital with a supplement plan one time, how much are you going to pay? Zero.
Nothing.
If you go two times, how much are you going to pay?
Nothing.
If you're there for 1 week, how much are you going to pay?
Nothing.
If you're in the hospital all year?
Nothing.
Nothing, right? So with a supplement, you pay zero for hospital costs.
Yep.
Okay? Now, the supplement's also going to pay the 20% that Medicare doesn't charge.
Yeah.
So when you go to the doctor, you have no copay. When you go to a specialist, you have no copay.
Yeah.
You get an MRI, you don't pay anything. Get a CAT scan, CT scan, don't pay anything. If you
There's
get
no worries.
no worries. And so
That's the truth.
it is. Now the worry is the premium, right? Not everybody can afford
Well,
a Medicare supplement.
Yeah, but you know what? Now you know exactly how much you're going to spend in 1 year.
So
That's it.
That exactly. So
You
and
can plan your life.
So we would agree that now you're retired, but you're working here some. But most people that are on Medicare are either retired like you, working part-time and helping out with the grandkids and stuff like that. But most people are on a fixed income.
Right.
And our biggest unknown cost, I mean, you're pretty healthy. I mean, you haven't missed a day of work since you've been here for 2 years. So you take really good care of yourself, but you never know. But your biggest unknown cost still is your health care. You just don't know. Even if you're healthy, you could fall, you get hurt, get in an accident.
That's right. You never know. You can step off the curb the wrong way.
And so our biggest unknown costs are health care. So what I like about a supplement plan is what Sue just said, which is it takes your biggest unknown cost, which is your health care, and it makes it a fixed cost. Because you know as long as you pay your monthly premium for that supplement plan, like Sue said, you're not going to have any surprises. Now, as you can tell, I'm trying to present both options, but Sue chose a supplement, and that is what she chose. But you know, both options are there. And I think what helped you, because we're thinking about it. So the supplement, to summarize that, is it's going to cost more per month, but in return, it's going to pay the bills that Medicare doesn't pay. You keep your doctor, go to any hospital, same coverage nationwide. And also on drug coverage, you get a separate drug plan. But what's nice about that is you have 30 different drug plans to choose from. So you actually get to choose the drug plan that's going to save you the most amount of money on your specific medications, right?
Right.
Now, what really helps people that might be on the fence about it is the only time in your life you're automatically approved for a supplement is when?
When you turn 65.
Exactly. The only time you're automatically approved for a supplement plan, so that means you don't have to go through any medical underwriting, is when you first turn 65 or you're new to Medicare Part B.
Right.
Once you're new to Medicare Part B and you turn 65, you have 6 months after, and that's the only time in your life you're automatically approved with a supplement. So if you're on the fence about it and you choose a Medicare Advantage plan, and then let's say a couple years later, you're like, I don't like this, or 6 months, or 8 months later, or 12 months later, or 2 years later, I don't like this. I don't like having an HMO. I don't like having a PPO. I don't like having copays. I don't like having to get permission to go to the doctor. I don't like that I can't just go where I want to go. I don't like that I've met the $6,000 max out of pocket the last 2 years, right? Where a supplement would have been cheaper because you would have just paid the premium. So let's say you want to upgrade from an Advantage plan to a supplement. Well, you're going to have to go through medical underwriting. So you're going to have to answer health questions. They're going to pull your medical history, your prescription drug history, and an underwriter is going to have the choice to say yes or no if they're going to accept you in the plan. The only time you can bypass that underwriting for most people is when they first turn 65 and or they're new to Medicare. So what I always try to help people do is, on your dining room table, you have 2 stacks of, for lack of a better word, stuff, right? All this stuff in the mail. And if you look at the Advantage, it's going to be the 0 premium all-in-one on one side. If you look at a supplement, it's going to have a letter of a plan. It's either going to be an F, a G, or an N, or a letter. So if it has a letter and it says the word Medigap or supplement, that's supplement insurance. So everything fits into 2 categories. And before you can go through which plan is the right one for you, you have to decide what type of coverage you want. Most people, you kind of have a gut feeling once you truly understand, are you an Advantage plan person or a supplement person? And a big motivating factor to help you with that you should be aware of is if you choose an Advantage and later want to upgrade, you may not be able to.
Right.
So what I ask people is this: waste of money or cost of living. So let's say you choose a Medicare supplement plan, and you've been like Sue, and you've been healthy the last couple of years. And let's say your supplement plan's costing you, just to keep it easy, $100 a month. And you go the whole year, and you go to the doctor a couple times for the year. So you don't really use it a whole lot, right? Which is great. At the end of that year, are you going to look at your supplement premium of $100 a month like a waste of money? Like, oh darn, I should have gone with that Advantage plan because this year I would have only had that $25 copay for this and a couple $35 copays and maybe a $200 MRI. Like I should have gone with the Advantage because I wasted my money on a supplement. Or are you going to look at it as a cost of living?
It is.
So now, and again, we offer all of it. We offer Medicare Advantage and Medicare supplement plans, and we offer all the top carriers. So no matter what plan is right for you, our big 3 things that we try to do is education, options, and service. We want to educate you on the difference between Advantage and supplement and then help you choose which one you like better, but give you all the information. And then we have options. We have all the top carriers, Medicare Advantage and Medicare supplement. So we're going to get you the best value. And then service. You never have to go online. You never have to talk to somebody different again. Sue will she does annual reviews. We have a couple other people that do that too. So she'll call you if you get a rate increase on your supplement and help you get the same exact plan for less money. If you have an Advantage plan, we'll email you, offer to help you find a different one if you're not happy with it. Your drug plan, every year in October, you get an email from me on October 1st offering our office to help you with your drug plan. So, it's just a good idea to really learn these things and work with a good agency that's going to help you every year. And Sue, I know you said you were camera shy, so I really appreciate you coming out here and having this conversation with me, because I do believe that you have a lot of the same questions that everyone else has. And I appreciate you working here and helping all of our clients review their plans, help them with the approval calls and canceling their old plans, helping them with questions and missed billings. I just really value it, and I just want to say thank you so much for joining me today.
Thanks, honey.
And I want to say thank you, everyone, for watching the Coffee with Medicare Bob. This series has been a huge hit on YouTube and our Facebook page, so we'll keep them coming. And if you have any questions that you would like me to answer, just drop them in the comment box below. And thank you for watching Coffee with Medicare Bob.